Philippine NARS listeners and followers. Kumusta po kayong lahat? How are you all doing? I hope that you're doing fine. Well, Philippine NARS, as you know, is a public service project of the PNANV, or the Philippine Nurses Association of Nevada, in collaboration, of course, with our favorite radio station, PHLV Radio. So thank you so much for joining us today. Okay, so there is a healthcare professional whose job is rarely put in the forefront, but it is very important in the recovery and in the retraining of a patient. This is a speech-language pathologist. So speech-language pathology is the study and the practice of, and a practice that is focused on communication, on speech, on fluency of language, feeding and swallowing disorders. So speech-language pathologists, or we call them SLP, or they're also otherwise known as speech pathologists, and they are trained professionals who deal with these issues. So today, to talk about speech pathology is Dr. Sherry Perucho. Welcome, Sherry.
Thank you so much, Doris. Thanks so much for having me.
Of course. Yeah, it's about time we had you.
Oh,
we had
thank you.
you in here. So for a little bit of an introduction, Dr. Sherry Perucho serves as the clinical manager at the Nevada Community Enrichment Program, right? Mm-hmm. Where she oversees clinical operations and programs. And she is dedicated to coming up with innovative ways to provide evidence-based and compassionate care to the people that they serve. So her areas of interest includes dysphagia, cognitive linguistic deficits and language disorders, also voice disorders,
Mm-hmm.
right?
Right.
And motor speech disorders.
Right.
That's a lot of things that you're doing there, girl.
Yes.
So Sherry holds a doctorate degree in healthcare administration from the Virginia University of Lynchburg, Virginia, USA, of course. She has an MA in speech pathology from San Jose State University in California, and she is has a graduate certificate in disability studies from Deakin University in Melbourne, Australia. Wow, that's a whole continent away.
Yes.
Yeah. And also a Bachelor of Science in Speech Pathology from the University of the Philippines in Manila. So she has over 20 years experience in speech-language pathology, and she has worked in a variety of settings. So please welcome Sherry here.
Oh, thanks again. That's what an intro. Thank you
Do you
so
have
much.
anything to add to that?
Oh no, I think that's good. Thank you.
Well, that's good. That's good.
I do wear many hats.
Yes. Most of us healthcare professionals do, don't we?
Right.
This is crazy. But okay, so you are also a certified brain injury specialist trainer.
Correct.
Wow. My goodness. And you had a certification from the Academy of Brain Injury Specialists.
Yes.
And is that in California?
No, this is worldwide. This is, and we have the American Association is called Brain Injury Association of America.
Oh, okay.
So the certifications is through them, the
It's through
Academy of Certified Brain Injury Specialists.
Wow. That's good. All right, so let's get started. So can you tell us what a speech pathologist does, and what are the key responsibilities for your responsibilities for the patients?
Yeah, sure. So a speech-language pathologist helps people with communication difficulties, thinking skills like cognitive deficits, as well as swallowing deficits, and then other things like involving communication, like your voice, your ability to say your sounds, your ability to express yourself, your ability to comprehend what you're hearing. So we help people with that, especially after maybe like an acquired brain injury, for example, traumatic brain injury, or a non-traumatic brain injury, such as in strokes or brain tumors or brain infections like encephalitis. meningitis and things like that.
And those conditions would affect a person's ability to speak and verbalize, correct?
Correct. Most of the time, especially we see it a lot, especially in stroke patients. And so we have to evaluate them and make sure that we help them get back to their prior level of functioning.
Level. Yeah, yeah. That is a tough job, I would say.
Yes, it's
Challenging?
it's challenging, but it's really it's so important because communication is a basic human right, right? It's
That is
so
correct.
important to be able to communicate your needs and your wants, and sometimes after an injury to the brain, you know, that basic function, communication, is sometimes lost, or you know, not there anymore, at least for the time being, you know, while you're recovering.
Yeah.
And so it's difficult
It's
for that
frustrating.
person.
Must be frustrating, right?
It's very frustrating. And also it's like you're not sure, like, am I going to get it back?
Yeah,
You know,
you're right.
and also swallowing. Swallowing
I
is
was gonna
very,
ask,
yeah,
how would that
dysphagia.
affect? Right.
Yeah, so some people have what we call dysphagia, or swallowing disorder, and it's when you're not able to chew or swallow properly because of your injury, usually because of like a stroke, or
right.
sometimes because of head and neck cancer. Things like that, or maybe because you were in the ICU for a long time and you were intubated for quite some time, and so you're not able to swallow, and so that's very important. So speech pathologists are there in the hospitals. We evaluate swallow function, and we help them get back to eating by mouth versus eating through like an NG tube or maybe a PEG
IV
tube or IV nutrition.
Right,
Yeah.
right. Okay. So, what are the educational qualifications and skills needed for a speech pathologist? You have to be a doctor now these days, right? Or-
Actually, yes. For PTs, for
PT,
physical
yeah.
therapists, yes, it's a doctorate. But for speech language pathologists, the minimum level of education is a master's degree.
Okay.
Although a lot of speech pathologists also have a doctorate in speech language pathology. And then after that, so you do your bachelor's and then either a master's degree and a doctorate degree, but usually master's is the entry level, and then you after that you do a clinical fellowship year. Kind of like your residency year, where you are supervised during
How
that
long does
year.
that take?
It's about a year.
A year? Okay.
And then you take your boards. You can actually take your praxis exam as soon as you graduate, and then you can do your clinical fellowship year. And then once you're done with that, then you can apply for your American certification, which is your CEAS. So speech language pathologists, like most of us have our CEAS, the CCC, Certificate of Clinical Competence from from the American American Speech, Hearing, and Language Association.
Hearing and languages. Okay. All right. So you work for, is that a clinic setting where you work for?
Yes, right now.
Yeah, right now. So what are the various settings where a speech pathologist can work?
So we're pretty much everywhere. So you can, there's many different places where you can work as a speech language pathologist. You can work in a school setting, like CCSD. They always need speech language pathologists.
Really?
Yes, in the schools. You can work in a pediatric clinic. You can work in, private practice. You can do medical speech pathology in a hospital or a skilled nursing facility or a long-term, an LTAC.
LTAC or a rehab.
A rehab. And then for me, I work in an outpatient comprehensive neuro rehab. So there's many different places you could work. Some speech language pathologists choose a different route that are not quite medical. They do like accent reduction for like Hollywood,
Yes,
type
okay.
of thing.
You got to get rid of your Filipino accent.
The Filipino.
It's okay. It's fine. I mean,
I don't do that because I love accents.
I know, huh? I like it too.
I love accents, and it's just not something that I probably am not going to be good at.
Yeah,
because I can't do the different accents.
I guess there are certain situations wherein, like for instance, an English person needs to talk in an American American accent, or
like in Hollywood.
Yeah.
Mm-hmm. Yes.
Okay.
Or some people use it for business purposes.
That's true.
Yeah,
that's true.
So they want to be able to communicate with, others, maybe without their accent.
That's true. So, like a lot of business people, they want you to learn Chinese or Korean or whatnot. So that's, I guess.
So they can switch
back and forth.
And be understood. Yeah.
Fantastic. That's fantastic. Okay. So there are some listed types of speech disorders. When do they occur? I mean, there's language disorders, there's social communication disorders, cognitive communication and swallowing disorders.
Right.
So when do they occur, and how do you approach the treatment of these various disorders?
Sure. So they occur typically, after an injury to the brain, but other times it could be developmental in nature, like in cases like autism spectrum disorder or other developmental disabilities. But the area of focus for me is language disorders that are due to acquired brain injury. So, for example, aphasia. If you're aware of the term aphasia, is a language disorder caused by an injury to the motor speech area of the brain, and typically people with aphasia have difficulty getting words out, verbalizing words, or they may sound like their speech is telegraphic. And then there's another form of aphasia, which is difficulty understanding what people are hearing. So, for example, they're very fluent. They are saying the words correctly, but they're like a word salad. They're not making sense. So that's also a form of aphasia. Incidentally, June is actually National Aphasia Awareness Month.
Oh, really?
Yes.
Nice. Oh, good.
Yeah. So, and I see a lot of people with aphasia. It's frustrating because language, it affects not just expression. It could also affect your comprehension, your hearing, your listening, as well as your reading and writing. So all those areas of language. For social communication disorders, some people with autism, like I mentioned earlier, may have difficulty, taking turns in conversations, or maybe picking up nonverbals, like your facial expression, or staying on topic. But people with brain injuries sometimes have that issue too. It's called a pragmatic deficit. You're not able to read, the nonverbals of the person, or you're just, a little bit, you have a little bit of difficulty kind of initiating a topic or
conversation. Right.
Yeah. And then another thing is cognitive communication deficits, which is common also in neurodegenerative disorders like Alzheimer's or Parkinson's disease, right? And this is when the cognitive domains are affected, which are your attention, your memory, your problem solving, your executive function skills, your awareness, your metacognition, right? Those are affected. And
Is dementia in there too?
yes,
Yeah,
yes.
okay.
So in dementia, typically you lose you have difficulty with memory.
Memory.
Either short-term memory, right? The long-term memory stays, and for some reason,
yes.
short-term memory is affected.
Right.
Also, working memory is affected, right? Your ability to, do mental math or calculations, or
Right.
remember a phone number while you're, on the phone, listen, while you're asking somebody for their phone number, having those difficulties. So
Okay, so how would you approach treating these
so
different things?
first we do a thorough evaluation. So whenever somebody comes into our clinic, we have to do a thorough evaluation, initial evaluation, where we look at their history, we look at their prior level of function, like what were they able to do before that they can't do now.
Okay.
And then we look at different areas of communication and swallowing. So I like to assess speech. I like to assess their ability to produce sounds. I like to assess their ability to produce voicing. So sometimes you see hoarseness or changes in vocal quality or intensity. So we assess that.
Yeah.
And then we assess all the language components. Comprehension, expression, reading and writing. And then you go into attention, memory, problem solving, planning, sequencing, all of those things.
Wow.
And then if the family or the patient has swallowing problems or a history of swallowing problems while they're in the hospital, then we also do an assessment on that. So to make sure that they're able to eat and drink safely, because what we don't want, most of the time, if you have a swallowing problem, they are at risk for getting food or liquids
in the lungs.
So we don't. They are at risk for aspiration pneumonia, and so we want to make sure we address that from the get-go. Yeah.
So now, do you also deal with the family members, with your treatment plan?
Yes.
Yeah.
And at NSEP, it's very very much person-centered and family-centered. So we want the family to be present during the evaluation because they can give us more information as to how they were doing prior to their injury, as well as how, what are their personal goals. Because it's very important to us, very important to me to know what the person's personal goal is. If the personal goal is for them to be able to eat adobo or in rice, then I take that very seriously, and I want to make sure that they're going to be able to eat rice, without choking.
Yeah, and it's personal satisfaction for them, right? And making sure that maybe hey, I'm getting better, right?
Right. Or just the communication. Like sometimes they're not able to communicate their basic needs and wants, like going to the bathroom, or they're in pain, or they want to go to sleep. So I want to be able to ask them, or at least the family, if they're not able to tell me, is this something that's important to you? And if so, that's what we're going to work on. Yeah.
Oh, that's good. That's good. Oh, my goodness gracious. You definitely... Well, I never thought that, you had this whole rigorous
scope,
plan and scope of practice of what you do. That's incredible. I mean, I'm learning every day. So
that's good.
That's good. Thank you for explaining all that. So I know that you are a certified brain injury specialist. And there are two scenarios that I sort of kind of want to discuss with you in relation to speech pathology involvement. So they are brain injury and rehabilitation as a result of other clinical situations, maybe a stroke. So can you discuss those scenarios and how you would handle those?
Yes. So I, aside from being a clinician, I also like teaching about brain injury, not just patients and families, but other clinicians,
Yeah.
right? Because neuro is a very difficult field to navigate, but it's also most rewarding if you're able to help people, right? And so at NCEP, we help, our focus really is comprehensive neuro rehab after an acquired brain injury. Although we also see people with spinal cord injury or or other conditions, but we like to train families, because brain injury is it changes not just a person, but the entire circle of support of that person.
Right.
And so the management of brain injury is very, very complex. And so you need to make sure that you're addressing all of that. A lot of times people with brain injuries, their injury happens, and it was very unexpected, right? And so it changes everything. It changes their lives, and it changes their families' lives.
So most of these situations for brain injuries, do you think are they mostly from accidents, or are they sports related sometimes?
That's a good question. So the Brain Injury Association has like a kind of like a incidence and prevalence numbers about brain injury, and the most common reason for brain injury, the most common etiology for brain injury, are falls. Like people falling.
Okay.
So regardless of age. So from children 0 to 4, that's the very common. Children 0 to 4, and
I thought it would be more on the elderly.
yeah, so 0 to 4, falls is the number one. Also for people 65 and older. Yeah, it's also falls. For adolescents, 15 to 18, it's motor vehicle accidents. And then for young adults, it's motor vehicle accidents, as well as gunshot or assaults, things like that.
Right. Okay.
Yeah.
Where does sports fall into
Yes.
this
So
category?
sports is also a very common reason for a brain injury. In fact, concussions.
Yes, concussions.
Concussion is considered a mild brain injury, so mild traumatic brain injury, and so we see a lot of that in young children, and also in sports, like professional sports.
Like football,
or,
I know that's why they wear the helmets, but that has been a concern, that has been put up there into public awareness.
Right.
So,
In fact, I think this is very new. The CCSD we're kind of creating a partnership with CCSD, so we can help the children with concussions, and they can come to us so we can assess them and help them with while they're recovering.
So. Well, that's great. Okay, so how about rehab?
Rehab.
Yeah.
So rehab.
Rehabilitation, by the way. Is short for
Rehabilitation. So neuro rehab. Neuro rehab is so important because, like I said, that is, it's very sad when you have an injury and you have all these deficits, right? But there's hope. I say neuro rehabilitation is the clinical. The clinical term for hope, I think.
Oh, wow.
Yeah, and neuroplasticity, because there's hope. Okay, I know. And so I work with wonderful people. I work closely with the physiatrist, the the PM&R doctor, right? The physiatrist, we have nurses, rehab nurses, and we work with physical therapists, occupational therapists, dietitians, and in the hospitals we also work with respiratory therapists. And so we are a team,
a collaborative team.
We are,
correct,
and there's sometimes meaningful overlap with what we do to help the patient. So you know, speech sometimes is kind of like separated from OT and PT, but in reality we all kind of like work together, to help the patient and their families.
So you do you work, you don't work as an individual practice right now, right? You work with a clinic and agency type thing.
Right. Okay. So I actually manage the team. So I'm not so much on the floor, Doris, not anymore. But I do help make sure that the clinic is running smoothly. But then from time to time, I still am on the floor, in the trenches with the clinicians, because I love doing that.
Managing is the brain of any kind of agency or an outfit. So what are you talking about? Well, I don't anymore either. More it's on the management side, but then you still want to get your hands, in the till.
Right. And so, and my passion too is really making sure that the new therapists, the new clinicians, get to be the best that they can be, right? And to really mentor them so that they love what they do.
That's good. So, do you collaborate with local and state agencies for servicing people who would need speech therapy?
Yes. Okay. So we do. So we obviously work with insurances, right, and then we also help. We also work with the school district. Like recently, we're going to be doing this collaboration for mild brain injuries for their students, and then we also work with individuals, that. Because we also do case management at NSEP, and so we kind of collaborate with the legal aid services. We collaborate with social security, disability, DMV, to make sure that
DMV also,
to make sure that they get the help that they need before they leave the program. Also housing.
You have another passion, which by the way. Dr. Perucho here is part of an organization called Accessible Spaces, and you will be hearing about that. We are the FASI group is going to be interviewing you, by the way. So let's go. That's another whole subject.
Yes, that's a whole different subject.
That's a whole different subject.
Altogether, yeah.
Love this woman. Anyway, so I was researching online, and the U.S. Bureau of Labor Statistics show the top 15 states of the highest location quotient for speech-language pathologists in the country, but Nevada is not in the list. So according to healthgrades.com, there are 625 speech pathologists practicing in Nevada with an average of 3.8 stars rating. So I don't know what rating that is. Do you have any idea or any info on Nevada statistics? And do we actually have a shortage?
Right.
What about statistics on Filipino Americans?
Filipino Americans. That's good. Unfortunately, I don't have the actual statistics for Nevada.
Well, it's not on the internet. I guess we don't know.
Right. I don't know the actual numbers, but from my experience hiring people, it's very difficult to find speech-language pathologists in Nevada.
Oh, wow.
They joke about it. My bosses joke about it. Every time I'm looking for a speech-language pathologist, they say it's like a drop of rain in the desert. It's very difficult to find one.
Finding a needle in a haystack, so to speak.
Right.
Oh my gosh.
And it's especially because medical speech pathology is very specialized. So when you're working with specialized cases like neuro and neurodegenerative and swallowing disorders, that's not very, very common. a lot of the SLPs in Nevada are working in the schools, in the school setting.
Okay.
And so it's very difficult to find somebody whose area of practice is medical speech pathology. But that's about to change, I think, because Nevada State University opened a program a few years ago. We did not have that before. We only had a program in Reno, Nevada. So compared to other states where they have multiple programs, Nevada only had one. And so we were not producing a lot of speech-language pathologists to begin with. And so not a lot of people are moving to Nevada either. So I'm actually from California, and they recruited me from California. So I'm here.
It's more fun over here.
And they said there's a great need for SLPs.
There is.
And then there's not very many Filipino speech-language pathologists either.
Yeah.
When I started, I think when I graduated from UP, there were less than maybe 20 SLPs in my cohort.
Oh my gosh.
Yeah, so that's not a lot. And then a lot of them use speech pathology as a pre-med course, so they're now doctors. So a few of us decided, nope, we're going to be speech-language pathologists. But the good news is now you can, and when I became a speech pathologist in the Philippines, they did not have a board exam for us, unlike the PTs and OTs.
Right.
And so we worked. I wouldn't say I'm included in that because I didn't really help anybody, but we did advocate for it. The Philippine Association of Speech-Language Pathologists advocated for the board exam and for the PRC to recognize speech-language pathology.
So now there is a
there
board
is
for it. Wow.
There is. It's wonderful. There is,
Wow.
and in addition, it's not just UP that has the speech-language pathology program, which is a great program, right? But they have it in the University of Santo Tomas. I think De La Salle University has one.
Wow. Okay.
University of Cebu, and other universities in the Philippines. So
if you get board certified over there, is that recognized here, or do you have to take
I think you need
exam?
You need to do. I think you need to do the master's program.
The master's
here,
program.
because when I
I
graduated,
see.
it's just a bachelor's. So you can in the Philippines you can practice with a bachelor's degree. But that's also changing because now they have a master's program now too.
Oh my God! Yeah,
it's a growing field.
It's a growing field, and it's definitely needed. As with all of these things going on, the disorders that you see, these disorders like relatively pretty common these days.
Right.
And there's not a lot of help. Or maybe people don't even recognize that.
Right. I know when I first started, people had to ask me like what I do and have to explain to them like I explained it to you.
Yeah.
Like this is what speech pathologist does. So now I think the Philippines are learning more about it. Yeah.
Well, that's good. I mean, anything that would improve the profession is really good. So, do you or other speech pathologists engage in other work, like maybe some research or training or counseling and all that?
Yes. So a lot of speech pathologists go to research, and so that's why it's growing. And even in the Philippines, I know a lot of my colleagues from the University of the Philippines, from UST, that do actual research, so that we can actually get data that's our own data.
Your own data.
Yeah, right. A lot of times we depend on studies from abroad, and now we're the Philippines is kind of starting to do that as well,
and gather their own statistics, right?
Their own statistics, and then collaborating with other countries too, like Japan, the U.S., everywhere. And I see a lot of researchers in this field that are Filipinos.
Oh, that's good. What about counseling?
Counseling per se, not like the professional counseling
Right.
we do, but more counseling on communication disorders, counseling on appropriate diets, appropriate diet textures. Appropriate liquid consistencies. So even in the Philippines, they follow the dysphagia, the IDSI, we call it IDSI, the International Dysphagia Diet System. Yeah, I think it's IDSI.
I gotta look that one up.
Yeah, forgive me, guys, if
No,
I
that's
forgot
okay. I'm not even aware that there's such a thing.
I say IDSI, but for example, somebody that is just starting to eat might have to be on a really modified diet, like a pureed texture, and then increasing to regular textures, and then the liquids, from mildly thick to regular.
Wow. Yeah. Wow,
So-
you're just a wealth of information, girl. So, what is the part of the job that you love the most?
Oh, that's great. I love doing what I do, but I think my favorite part is seeing somebody say their first, like say something. Like the other day, I had a patient, and he started with us not able to say anything, and then one of the staff members said, say her name, she'll be happy if you say her name. And then he said my name.
Oh my God.
And I was so happy, I was so excited, and I was like jumping up and down, and I'm like, I'm so proud of you. So I love that. And also when people are able to eat their favorite food.
Oh, of course.
I love to
Wow.
eat, so I like to be able to share that joy with them when they pass their swallow exam.
Oh
right?
my God,
and
that's
then
awesome.
and then they eat their favorite food, or they say, I'm going to the restaurant with my loved one. But as a healthcare leader,
Yeah.
my favorite is being able to open doors for new clinicians to be able to be the best that they can be in what they do, and be passionate about neuro rehab. That's my favorite thing.
Yeah, that's very good. I mean, what can I say? So what is your message to the community here in our community with regards to speech pathology?
Yeah. Well, I think I mentioned it earlier. Communication is a basic human right, and if you or your loved one is having difficulty with speaking, understanding, or swallowing, you don't have to go through it alone. Speech-language pathologists are here to help, and you can ask your doctor for a referral so we can see you and help you, because there's help out there. And early intervention and early support really makes a huge difference.
Yeah, that's for sure. So that's why we're conducting, this interview too, and that's the premise of actually a Philippine nurse, is to create awareness to the different needs of the community. So.
And I also wanted to add, Doris, that for our PhilAm community, representation matters.
Exactly.
And I'd love to see more Filipinos in this profession. And we need providers who understand our culture, our language, our values, because it really makes a difference in their recovery. When when you have somebody that can actually
looks like you,
and treat you
right. And that's really important because, Las Vegas has now over 200,000 Filipinos here, and there is a shortage of professionals, not only on the speech pathology that are actually Filipinos. In nursing wise, I mean, we have that, but the allied professions, that is the big challenge, and that is also a very great need in the community.
And it's a great career, There's so many different options where you want to focus on or your practice. therapists can focus on. So
Well, there you go,
it's a great
folks.
career. Yeah.
So
I want people to be SLPs.
SLPs, speech language pathologists. So there you go, ladies and gentlemen. That is so wonderful. And so, Dr. Sherry Perucho, thank you so much
Oh, you're so welcome, Doris.
joining us our program today. Is there anything else you wanna say?
Thank you so much for inviting me, and thank you for all that you do. I love your program.
Oh, thank
It's-
you.
Yeah.
Well, thank you very much. So we do appreciate what you do, really, for our patients. And so thank you so much. Again, beyond her clinical interest, Dr. Perucho is also dedicated to servant leadership and believing it is integral to the healthcare profession. So she's very passionate about helping other clinicians to be the best that they can be through mentorship, training, and education. So thank you again.
You're so welcome.
Okay, Dr. Perucho. And to our listeners and followers, we leave you with this. A speech-language pathologist, or an SLP, also known as a speech therapist, evaluates and treats speech, language, voice, and swallowing disorders. They work with individuals across the lifespan, from infants to adults, to support and improve communication and safe eating and drinking. Whether this is due to a developmental disorder, a neurological condition, or injury, challenges with speaking or swallowing can make daily life more difficult. And since communication is a vital part of being human, it is easy to overlook until it becomes a struggle. So that's where an SLP can make meaningful difference. These professionals are specially trained to address a wide range of issues and offer support to both that's both practical and life-changing. So if you or someone you care is experiencing these difficulties, please do not hesitate to reach out to a speech-language pathologist, and they can be an important first step towards better communication and improving your quality of life. So thank you very much for joining us today. Please be safe and be well. And until next time, this is Doris Bauer, your Philippine nurse host, signing off for now.
Just like a friend from back home.
This is your Filipino radio experience in Las Vegas. PHLV Radio.